Hey boss, it's 7 o'clock. I gotta go. But the queue is a mess. There's like 5 cars in drive-thru. The phones are ringing off the hook. You sure you don't want me to stay for the last hour? Don't worry about it. It is what it is. They cut our hours, so now I gotta open by myself for an hour, and now I gotta close by myself for an hour. But let me go grab drive-thru. Alright boss, well have a good rest of the night. I apologize about the wait and drive-thru. But I'm the only person working right now. And between the phones and people dropping off and picking up and me giving vaccines, I'm just a little busy right now. I remember when he first started working here, he was such a happy-go-lucky person. Now every day he comes to work sad and depressed. He's not even the same person he used to be anymore. Ma'am, I apologize. I will help you as soon as I can. Right now, I'm trying to get a transfer for somebody else who's waiting. Sorry about that. Now, what was the RX number? I hope the profession gets better for him. 5 pharmacy calls. I'm never going to catch up. Thank you for calling the pharmacy. This is the pharmacist speaking. How can I help you?
Can I please speak to the pharmacy manager?
Yes, this is him.
Hello, this is Dr. Stewart. We have a mutual patient, Patricia Beverly.
Yes, I know Mrs. Beverly. She's one of my favorite customers. How is she doing?
Apparently she fell down a few stairs after getting lightheaded and fractured her hip. Apparently her bottle of metoprolol, 50 milligrams twice daily, had metoprolol ER 50 milligrams instead, which she took for 2 days.
Oh my God, I am so sorry. Is she okay?
She has an infection and is a lot of pain for an 85-year-old woman. This is very dangerous. You need to be more careful.
Look, doctor, not that this is a valid excuse, but we've been so understaffed lately.
If they don't get you more help, someone is going to die.
Hi, I'm here to pick up my medication. Tom Ford, 11th of the 2nd, 1970.
Okay, let me go grab that prescription for you, Mr. Ford.
Okay.
Okay, looks like I have one prescription here for you.
Are those my omeprazole capsules?
Shit, these are tablets, not capsules. I must have made a mistake. Let me go double check something real quick. I'll be right back.
What's wrong with it?
It's nothing. I just have to double check something real quick. I'll be right back.
Okay.
I forgot about the guy who needed an immunization. Sir, I apologize about the wait, but I'm super swamped. I'll be out there to give you your vaccine as soon as possible, okay?
I've been told that 3 times already. Plus, I made an appointment.
I'm sorry, but I'm just working by myself.
I've been waiting 30 minutes to get my shot already.
Okay, I'll be out shortly. Just give me 2-3 minutes.
Hello? Is anyone going to answer the damn phone? I've been calling for 30 minutes.
I apologize, but I'm the only person working right now. Between drive-through, out window, pickup, and giving vaccines, I just don't have time to answer the phone.
My father has been trying to get his medicine for a week now, but the lines are too long. He can only stand in line for so long, and the drive-through is always wrapped around the building. He ended up in the emergency room because he's been without medicine for almost a week now. You need more help before someone dies.
I don't think I can be a pharmacist much longer.
I transferred his meds here because the last pharmacy was so busy. I mean, is every retail pharmacy understaffed? This is definitely not safe at all.
Sir, it's like that at most retail pharmacies, unfortunately.
Look, I'm going to call corporate on you guys right away and talk to your manager and their manager and take this to the very top. This is BS. I've been dealing with this for too long now.
I'm sorry, sir. I don't mean to be rude, but I have to give this guy his shot. I'm truly sorry. Okay, sir, we're done, and I apologize about that. And I'm sorry it took so long to get you your flu shot.
Flu shot? I don't need a flu shot. I need a pneumonia shot. I already had a flu shot at my doctor's office.
Oh my God, I can't believe I gave this man the wrong vaccine.
Oh my God, this place is dangerous.
He's right. We're so understaffed. We are going to kill somebody. Thank you for calling the pharmacy. This is the pharmacist speaking. How can I help you?
Last week I came through the drive-thru to pick up my mother's medication, and the technician gave me some other person's prescription. I had to drive all the way back out, only to find out that my mother's prescription, which has all of her personal information on it, was given to someone else.
Sir, I am so sorry.
And then I had to wait another 20 minutes for them to refill the medication. If she had actually taken that medication, God only knows what might have happened.
I know it's not a good excuse, sir, but we're just so busy.
Oh, and that's not all. My insurance company changed, so I have to use a different pharmacy. And when my new pharmacy called to get my medication transferred, they said they were on hold for over an hour each time, and they couldn't transfer my medications. 2 days ago, I had an asthma attack and no rescue inhaler and ended up in the emergency room. What's going on over there in that pharmacy?
Sorry, sir. We are so understaffed, it's not even funny anymore.
Well, you being understaffed could have killed me and my mother.
I'm so glad to be home from that shit show.
Hey, how are you? How was work today?
Same as always. Same shit, different day. And work is so bad, I've drinking this whole bottle. I gotta get out of retail pharmacy, but I just don't know what to do.
I wish you didn't have to work that job. It literally drains the life out of him.
I never used to drink until I started working retail pharmacy.
Daddy, come play with me.
No, not right now.
Why not, Daddy?
Because Daddy is tired.
Daddy, what are you doing?
I said not right now! Honey, I didn't mean it. I can't believe the person I've become. When I get off of work, I just sit in my car for 30 minutes and decompress. I can't even get my hands to stop shaking so I could drive. The only thing that I found to calm my nerves is alcohol. And when I'm driving home from work, I feel like I have no soul, just so empty. It's like my job haunts me. I think about the customers that yelled at me. Why did I even go to pharmacy school? Why did I even want to become a pharmacist? What was I thinking? I think about the patients I've harmed, and I think about the mistakes that I made. I try to forget about my job, but I just can't stop thinking about it. I think if I quit retail pharmacy, how will I pay my student loans? How will I pay my mortgage or my daughter's tuition? I think to myself, there's no way I could do this for the rest of my life. But what other options do I have? Sometimes I feel so overwhelmed. I feel like there's only one way out of this.
Take me deeper than my feet could ever wander, and my faith will be made stronger in the presence of my Savior. Spirit, lead me.
And sometimes just the thought of having to be a pharmacist for the rest of my life is just too much to bear.
Wherever you would call me, take me deeper than my feet could ever wander, and my faith will be made stronger.
Hey, hey, what's wrong?
Pizza is not working.
Retail pharmacy staffs across this country are forced to work in terrible working conditions that are not conducive for patient safety. They're often understaffed and overworked as they are forced to try and meet company metrics that have nothing to do with patient health outcomes. Now pharmacy staffs are asked to give COVID vaccines on top of their everyday tasks, often without additional help. Now more than ever, many pharmacy staff members are experiencing anxiety and/or depression due to these horrific working conditions. Some people have even had to go to the emergency room due to working long shifts with no breaks and inadequate staffing. Due to the possibility of retaliation, many pharmacy staffs are afraid to speak out about these terrible working conditions. Now is the time to help save the profession of pharmacy. Understaffing and its threats to patient safety due to unsafe practices by pharmacy chains must stop. You can help by contacting your State Board of Pharmacy and your legislator. Continue to support #SheWaited and #PizzaIsNotWorking.